Hello future dentist and exam warrior. Have you ever seen a patient with a backward lower jaw and wonder how orthodontics guide this jaw forward without surgery? Today we are going to learn one of the most important functional appliances in orthodontics, that is a twin block appliance. And trust me guys, this topic is super important for Viva, theory exam, practical understanding, university short note. So stay till the end because I will explain everything in very easy English with a diagram and the memory trick. So what is twin block appliance? So first of all, what exactly is a twin block appliance? So here the twin block appliance is a functional orthodontic appliance which is used mainly to correct the class second malocclusal due to the retracted mandible. Simple language में, this appliance helps to bring it forward. It contains one upper plate, one lower plate and inclined bite plate. Okay, so this appliance consists of an upper and a lower plate having the occlusally inclined bite plate. So these bite block guide the mandible forward. Can you tell me in which malocclusal twin block is commonly used? The answer is yes, class second malocclusal. Now let's see the components of the upper appliance. So first one is the appliance consists of an upper and a lower plate which is having occlusally inclined bite plane. This means the appliance has a two separate part, upper plate and the lower plate, and both contain inclined bite plane. These inclined plane force the lower jaw to move forward during closure. So easy trick is think of them like two ramps which is sliding against each other. So look carefully at the diagram. You can see this is a pink acrylic plate. This is a pink acrylic plate. It bite block area. This is a bite block area. And the clasp for the retention. There you see this is a clasp which is for the retention. So this appliance sits over the teeth and guiding the jaw movement. Now here the upper plate is retained by the modified arrowhead and the clasp. Retention means holding the appliance firmly in place. And modified arrowhead clasp, this helps the upper appliance stay stable on the teeth. So what happens if retention is poor? Correct. The appliance become loose and the treatment will fall. Okay. So the clasp can incorporate a tube for the attachment of the face wall. So this is very interesting. A tube can be added in the clasp so that a face wall can be attached if needed. So this gives additional orthodontic control. The upper plate can also have a jack screw. So this is the upper plate which is also have a jack screw in case maxillary arch expansion is required. So if the upper arch is narrow, a jack screw can be added for the expansion. So twin block can also help in widening the maxillary arch. So what is the function of the jack screw? Yes, the answer is arch expansion. The upper appliance consists of the bite block that cover the lingual cusp of the upper posterior teeth. So you see this is a lingual cusp of the upper posterior teeth. So it is covering the lingual cusp of the upper posterior teeth, extending anterior till the mesial ridge of the upper second premolar. So this is the upper second premolar. So it is extending up to the mesial of the upper second premolar. Okay. So here the bite block, this help in proper interlocking with the lower bite block. Okay. So now look at this component diagram. So this is very important fiber diagram. You can clearly identify this is an upper acrylic plate. This is a lower acrylic plate. Here you see this is a retention clasp, inclined bite block. So this is an inclined bite block. So the arrow in the figure show the forward movement of the mandible. So examiner may ask, show the inclined bite block in the diagram. So practice, identify them. Okay. Now we see the lower appliance. Now let's study the lower component. So here the lower plate is retained by the interdental ball clasp. So you see this is an interdental ball clasp. This is a lower plate. It is retained by the interdental ball clasp. You like this. This is a interdental ball clasp. Here this is an interdental ball clasp. Okay, so the lower appliance is retained using the interdental ball clasp. These clasps fit between the teeth and provide the stability. Okay. Now the second one is the lower bite block extend distally up to the distal marginal ridge of the second premolar. So this is the second premolar and this one is distal margin of the second premolar. So here it will be extending till up to the distal margin of the second premolar. So here, this means the lower bite block extend backward till the distal marginal ridge of second premolar. So important for the exam, always remember the extension level. Now the next one is the lower molar are cap free to help in the eruption if needed. So this lower molar are capped free to help in their eruption because it allows the eruption of the molar if required during the treatment. So upper and the lower bite block interlock at the 45 degrees. So you see, suppose, so this is the second premolar, so it is extending to the distal of the second premolar, and here it is a second premolar. In this case maxilla, it is extending to the mesial ridge of the second premolar. Okay, so it will be forming the 45 degree. It will be forming the 45 degree. Okay, so this will be help in interlock between the upper and the lower. Okay, so this is one of the most important point. The inclined plane interlock at approximately 45 degree. This angle helps the guide the mandible forward. So memory trick is twin angle means twin block is 45 degree guidance. Okay. Now we see the bite registration. So bite registration and the patient acceptance. So now come the bite registration. So here the mandible is sagittally advanced by the 5 to 7 mm. Means the lower jaw is brought forward by around 5 to 7 mm. So how much sagittal advance is usually done? 5 to 7 mm. Vertically the bite is opened by 3 to 5 mm into the premolar region. So vertically the bite is open by 3 to 5 mm in the premolar region. Now we see patient acceptance. So one big advantage of twin block is excellent patient acceptance. Why? This appliance is very good patient acceptance due to the following reason. So first one is greater freedom of the movement. It means greater freedom. That means the patient can move jaw more comfortably compared to the other functional appliance. Second one is less interference with the normal function. So it causes less difficulty during the speaking and the chewing. Third one is facial improvement seen in 2 to 3 months. That means the patient becomes motivated because the facial appearance improves quickly. So why do patients like twin block appliance? Because it is more comfortable and give faster visible result. Okay. So guys, today we learned component of twin block, upper and the lower plates, bite block, 45 degree interlocking, bite registration and patient acceptance. So this is very important exam topic in orthodontics. So revise those points again before the exam. If this lecture helped you, then like the video, subscribe to Exam Viewpoint Dentistry and press the bell icon. See you in the next dental lecture. Bye Future Dental.